Missing teeth result in bone loss. Loss of bone can contribute to premature aging of the face. Dr. Singh, how is that possible?
Okay, that's possible because once you lose the tooth, we've already discussed how we lose the bone, but once we lose the tooth, we do lose bone around it. And as a result, your bite is not stable anymore. Your jaw swings upwards, and essentially the lower part of your face collapses. What we call lower face height decreases. We probably all remember grandmothers, grandparents, etc., who had lost their teeth, and essentially as a result that lower face height decreases, and it gives them a much more older appearance. It can even happen in younger people. You might recall a few years ago one of our patients was featured on the Toronto Star, and he was a very young man who had unfortunately lost all of his teeth and looked much older than he actually was. We have his picture up on the screen right here, and as you can see on the left is the way he appeared when he came in. Certainly he looks much more than 24 years old, I believe he was at the time, 24 years in this picture. And the only difference from this picture on the left to this one on the right is the fact that he has an appliance in place, a prosthetic that replaces all of his teeth. This actually was supported by a couple of implants, and it's a prosthetic that replaces his teeth, but also replaces some gum structure, etc., that had been lost, thereby restoring lip support, better facial balance, and a much more balanced and pleasing appearance. And most people have said that they think he looks about 20 years younger from left to right.
It's obvious. You can see the increase in height that the dental prosthetic brings to the picture.
And it creates a much more balanced appearance. It also creates a much better function for the patient, because as he's lost the support on the left side here, his chin would actually swing up much further. So in profile, he even becomes, much more prominent in the chin, having it swing up further, and it creates a lot of problems for his jaw joints, etc., because he's no longer functioning in an ideal position, but he's functioning in what we call an overclosed position. So jaw pain, headaches, discomfort, which were some of his symptoms, become much more common, and it's much more common with many other patients. In fact, a lot of patients have unresolved headaches and various types of neck aches and etc. that may be attributable to loss of tooth structure, loss of bone, an imbalanced bite, and that overall collapse leads to imbalances within the musculature that can eventually cause headaches.